Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have a special guest with us this week, Courtney Wood. She is the Long-Term Care Administrator of Masonicare Health Center. Welcome, Courtney. Thanks for joining us.
Hi, thank you for having me.
We're excited to have you here today to discuss a project that has been underway for some time and is nearly complete there at Masonicare Health Center, and that is the conversion of our acute care unit to a short-term rehabilitation center. We'd love for you to give us an update on the project. How's it going?
It's going fantastic. We are very excited to have the project underway, working with DPH, working with the local fire marshal, building inspectors, making sure that everything is up and running soon. We're hoping that by the mid to end of July, we can do an event and have people come in and see it. We'll be putting up some pictures. I know, Sandy, you're going to get some pictures so that they can see the progress of what's happening. But hopefully we can get that open and have everybody come and tour.
And what are some of the exciting features that are going to be part of the rehab floor there?
So some of the amazing features that we have going on up there and implementing are, we'll have 19 private rooms for the comfort of our residents during their recovery. There's going to be a satellite gym for the unit working with therapy. There's a private patio right off of the unit that people can go and enjoy the outdoors and the fresh air while they're here. We also have a wonderful clinical team that will be up there of doctors, APRNs, respiratory therapists, physiatrists, OT, PT, speech. We'll have a wound care doctor that will do weekly rounds just like we do throughout the rest of the facility. And then we'll have the ability to do telehealth appointments with the community doctors if it's necessary, and so many more things that we're implementing up there. It seems like every day we find something else to kind of put in there for special features. So.
Yeah, that sounds fantastic. And JP, the conversion of this unit to be a short-term rehab floor is really part of your overall strategic plan for Masonicare Health Center. Can you tell us more about that?
Absolutely, Sandy. Stepping back a smidge, the three Sturges, just the environment alone is truly amazing. When we started the process at Three Sturges, our own staff really took the bull by the horns and went in there and did painting over, tore down wallpaper, and even if you've been in there maybe 9 months ago, a year, 18 months ago, it looks different. It actually has really made a significant improvement. And I want to thank the staff at the healthcare center for taking on most of that work. And so it looks fantastic. But when we talk, what was that?
They did an amazing job. They worked so hard around the clock.
Absolutely. And I want to make sure we give kudos to them because it was a hard job for them to do, but and really take it on while they're still doing all the other work in the building. And when we look at our strategy, this is just one part of our strategy. We are expanding our behavioral health hospital from 29 units to 14. And that is due to open sometime in September. So it is definitely a process within our strategy. And when we look at our strategy, we actually have submitted a certificate of need with the state of Connecticut to go from 357 units down to 260 beds. And the reason for that, truthfully, is to create a better environment. We will be going from 43 private rooms to about 110 private rooms throughout our system. And a lot of that has to do with making sure that we can provide the service that we know we can provide and continue the excellence in care that we do each and every day. But we also understand what our consumers have been asking for and our existing residents and family members. This is going to enhance their experience. We also will be adding new furniture, changing out the wallpaper to paint. So there's quite a bit that we're doing within that building. And thanks to Courtney and her leaders within her building, I'm extremely confident that we can do this. And why this is important from our strategic side, we continue to look at ways in how the consumer is looking for new innovations, and the strategy for us is truly to do that. And as we've continued to see growth in our residential living side, our nursing home here in Wallingford really is a support mechanism for that, and the staff do a fantastic job, but we need to continue to adapt to the times, and this is just another way in which we're doing it. So I'm excited that we're able to do this at Three Sturges, but I'm excited to really announce that we're doing quite a bit within that building, really along that campus, to enhance the lives of those that we serve through a different environment. And I think that's really something that we're extremely excited to be able to do. And it, again, falls within our strategy as we move forward over the coming years.
Thank you, JP. Such wonderful things going on there. We appreciate the update. And turning to the latest news on coronavirus, Dr. Schwartz, the Delta variant continues to spread across the globe, and many health experts are concerned about its characteristics. Can you tell us what you've learned about it so far?
Certainly, Sandy. You know, every time we do these shows, there's something new to talk about regarding COVID. But first, I did want to welcome Courtney to our show and echo JP's sentiments. You know, it's been great to work with you. I just passed my 26th anniversary working for Masonicare, and you know, I've never worked through a pandemic before, and I say Courtney came at a really tough time, a very challenging time, and she's done a great job. And it's really nice for me just to hear all the great updates and things that are happening at the healthcare center, particularly. And I'm really looking forward to seeing these programs develop, particularly the rehab unit. So now we turn to the COVID update for the week. And this is regarding the Delta variant, which some of you may have heard in the news. I have a nice article, thanks for your help with this, Sandy, that I'm going to summarize a little bit, that is basically entitled, "What Should I Know About the Delta Variant?" And it's a nice basic article that kind of gives you the key points. So basically the Delta variant is a version of the coronavirus, and it's been found in more than 80 countries since it was first detected in India. So, you know, the World Health Organization names notable variants after letters of the Greek alphabet. So we've talked in previous shows about the coronavirus being an RNA virus, similar to like the flu virus is an RNA virus. So it's not unusual that viruses mutate. It's not unexpected. But what scientists worry about is that some of these variants might evolve enough to be more contagious and could even cause more severe illnesses, or even evade protection vaccines provide. And you know, what they seem to find, where the mutations come in this virus, and the target of almost everything is a spike protein. And the spike protein is where mutations occur, and they see that this may make the virus more adherent to cells in the body, and therefore more transmissible. So that's what's being very concerning. So I'll just read some data. In the United Kingdom, the variant is now responsible for 90% of all new infections. In the United States, it represents 20% of infections, and health officials say could become the country's dominant type as well. So it's definitely something to be concerned about. So they interviewed Dr. Jacob John, and he's a virologist. He studies viruses at the Christian Medical College at Venoit in southern India. And he said still it wasn't clear whether the variant makes people sicker. They needed to study more data, but studies do show that the available vaccines that we have work against variants, including the Delta variant. And there's some other reports here from researchers in England studied how effective the 2-dose AstraZeneca and Pfizer BioNTech vaccines were against it compared with the Alpha variant. And the Alpha variant was the first detected variant in the United Kingdom. And they say that vaccines were protective for those who got both doses, but were less so among those who got one dose. This is why experts are saying it's important to get vaccinated, to get both doses. And they're also making statements to make vaccines available globally. And this is why they say this is so critical. But you might also see in the news that there are talk, particularly from different scientists based on these variants, about new guidelines regarding wearing masks and so forth. And there's even more comments about, when you're in a larger crowd in certain situations, of continuing to wear masks just because of the variants that are being discovered. So now, for the moment of my inspirational quote for this show, and this is, here's the quote: "At the beach, life is different. Time doesn't move hour to hour, but mood to moment. We live by the currents, plan by the tides, and follow the sun." And this was written by Sandy Gingras, and she's actually an award-winning author of the How to Live series of books, many of them focused on beaches, islands, and the coast. And the reason I brought this quote up was, like a week ago today, I was in the Caribbean. I hadn't left the country, let alone the state of Connecticut, since February 2020. And I can't believe a week ago I was actually on a beach, looking at oceans, looking at, deciding what pool to swim in and whatever. And, it was a very safe process. I didn't leave the resort, and everybody there was vaccinated. But the point being that as I was lying on the beach, I thought to myself, 6 months ago I got my first vaccine. And I never thought 6 months ago I'd be on a beach, just looking at the ocean and being at peace again. And it really comes from all of us working together, getting vaccinated. It shows the importance of these vaccines, how much it really changed the course of this pandemic, and how we just have to continue to work together to be careful, to continue good health practices. And again, I thank everybody for all their hard work and diligence, and I know things are getting better and better. And once again, I wish you health and I wish you peace. Thank you.
Thank you very much, Dr. Schwartz. As always, the perfect words. Well, I want to thank all of you for sharing your time and your insights with us today, as always. And we thank you for joining us at home once again. Until we see you next time, we hope you'll stay safe and stay well.